Hello, everyone, and welcome again to NutriMD. Our topic for today affects some 400 million children all over the world. So, today's session is dedicated to providing a basic guide on how to manage G6PD deficiency condition. As always, your doctor can provide more extensive information and treatment for your child who has been diagnosed with G6PD deficiency. A good understanding of G6PD deficiency condition will lead to better management of the condition and result in a healthy, active life for your child. To help us with this topic, we invited a medical expert in Dr. Imelda Vitug-Sales, a pediatric gastroenterologist at the Makati Medical Center. Dr. Vitug-Sales, welcome once again to NutriMD. First up, can you help our followers to understand or to know what is G6PD deficiency condition?
Hi everyone, it's nice to be back in NutriMD. For today, we will be discussing G6PD, otherwise known as your glucose 6-phosphate dehydrogenase. Glucose 6-phosphate dehydrogenase, it's an enzyme in our body that helps us protect the red blood cells from damage. So this enzyme protects the red blood cells from premature destruction and injury. So your red blood cells, they're very vital for life because they have the duty of carrying oxygen from our lungs to deliver to all our body parts. So oxygen is needed for energy production in our body. If you have G6PD deficiency, then your body fails to make the adequate amounts of this enzyme. And if you're exposed to certain substances, certain food, drugs, or even environmental substances, then your red blood cells now would end up breaking down prematurely. It would get damaged, and you may end up having anemia. In newborn babies, they may present with jaundice. If it's not addressed, the jaundice may get worse and go up to the brain. The infant would end up having kernicterus, which is a serious form of brain damage.
What causes G6PD deficiency condition, and how common is this condition?
So it's actually an inherited condition that may be genetically passed to offsprings. So mothers are often asymptomatic carriers, and they may pass the gene to their offsprings, while the fathers may be symptomatic and may be carriers as well. So when a person has low levels of the enzyme glucose 6-phosphate dehydrogenase, then their red blood cells break down when their body is exposed to certain types of food or substances or even drugs, and may result to anemia. So it's the most common enzyme deficiency throughout the world, affecting around 400 million. It's more common in males than in females. In the Philippines, it occurs around 4 to 5% of the time. However, not everyone is symptomatic, meaning not all would manifest symptoms.
What are the signs of G6PD deficiency that parents should be on the lookout for?
So the signs and symptoms of G6PD deficiency differs depending on the individual. Some people with the condition, especially the females, they are symptomatic, meaning you don't have any symptoms. But the more common indicators would be, if these are mostly for infants, for neonates, newborn babies, they are jaundiced, so they're yellow skin tone, and they may have dark urine. Then as they grow old, if it's not addressed, or for older kids, they may become pale, so they have pallor. They're very lethargic because you have poor oxygen in your body, you lack oxygen. So you have high-pitched cry, your heart rate's quite fast. And when you do a blood test, then you find that your patient has hemolysis or anemia.
And are there certain food or medications to avoid for children diagnosed with G6PD deficiency? And can you give examples of them?
There's actually a whole list of substances that we don't give that they said to avoid when you have your G6PD deficiency. So children with G6PD deficiency should avoid a lot of foods, but the only proven ones as of now is fava beans. So you actually need to look at the ingredients. You make sure that there's no fava beans or white broad beans. And the list would also include blueberries, red wine, and soy products. With regards to medication, there are certain medications which should be avoided, which should include your antimalarials, sulfa drugs, and specific antibacterials. However, there are also certain medicines and vitamins that are safe to be taken in therapeutic doses. So for environmental substances, we would recommend that you avoid these naphthalene balls or what we call moth balls that we place in closets, not to prevent insects from coming in. Your doctor will provide you with a complete list of medications and food to avoid.
Well, thank you so much, Dr. Vitug-Sales. Just to summarize a few points, learnings from this session. Number one, up to 1.5 million Filipino children may be G6PD deficient. Second, understanding G6PD deficiency condition can lead to better management. Thirdly, diagnosis for G6PD deficiency is important. Always consult with your doctor. Are there any final word of advice on G6PD conditions?
As a final thought, if your child is G6PD deficiency, remember that treatment is always prevention. If it's not treated adequately, then your child may result in severe anemia. During the neonatal period or newborn babies, they may present with jaundice. They may end up having yellow skin if it's not treated. They may even go up to the brain and cause kernicterus, which would lead to brain damage. However, that's quite rare. The more common ones would actually be anemia. So infants and young children with G6PD deficiency, those are treated in a timely manner. They go on and lead a practically normal life. Again, there are certain dietary and medication restrictions that parents must adopt for their children in order to keep the condition from flaring up. Your doctor will provide you with this list of food and certain medications to avoid to make sure that your child will live a normal life. So strictly following your doctor's advice, children with G6PD deficiency can live a healthy and active life.
As always, thank you once again, Dr. Vitug-Sales. And to our viewers, thank you for watching NutriMD. For parents who are interested in more information on G6PD deficiency condition, we have developed a very simple booklet guide on tips for tots for G6PD deficiency. Inside, we provide much information, including medication and foods to avoid. Next time you're with your pediatrician, ask for a copy of Tips for Tots G6PD deficiency. If you want us to cover any topic on nutrition for your children, contact us at NutriMD, your child nutrition resource. Till the next session, looking forward to being with you.